Hey everybody, I'm Dr. Anthony Youn, America's holistic plastic surgeon, and today I'm going to go over with you something that's super important. 5 of the worst cosmetic surgeries. These are cosmetic surgeries that I don't perform in my practice for several reasons, and what I'm going to do is go over them with you today so hopefully you can avoid getting botched. Nobody wants to get botched. So the first operation that I avoid, or I recommend that you avoid, is breast augmentation with textured breast implants. So implants can come in 2 different types, smooth and textured surfaces. Textured surface implants have basically like a sandpapery surface to them, and they're typically used in the quote-unquote gummy bear implants and the implants that are called shaped or teardrop shaped. The problem with these implants is that textured shell increases or gives you a risk of a very rare type of cancer called ALCL, anaplastic large cell lymphoma. Now, this is a very slow-growing cancer. There have been over 500 cases in the United States, and some people have even died from it. Well, recently the FDA has actually issued a recall on one brand, Allergan's textured BioCell breast implants. They've asked the manufacturer to no longer sell these implants and the doctors to send the implants back. Well, there are other textured implants, however, that are still on the market. And although their risks of ALCL, this type of cancer, is lower than the ones that have been recalled, there still is a risk there. So doctors are still using them in patients even today. So what I would recommend for your safety, if you're going to consider breast augmentation, avoid any type of textured implants. That way you're going to have hopefully 0 or very close to that risk of ALCL. As of today, there have been no confirmed cases of patients who's developed ALCL with only a history of smooth implants. Every single patient who's had ALCL has had some type of history with a textured breast implant. Okay, so avoid that. All right, next, permanent filler injections. Now, if you follow me before, you know that I'm a fan of hyaluronic acid fillers like Restylane and Juvederm. But there are other fillers that are on the market that are FDA approved that are permanent or semi-permanent fillers. These can be very, very dangerous. 2 main reasons. The first one is if it's permanent and you don't like it, nothing you can do about it. You're going to have it literally cut out of your face if you don't like it. In addition, it's permanent, you can actually develop permanent complications later on. I've seen some patients who've had injections of permanent filler, it looked fine for a couple years, and then all of a sudden it started getting hard and it started actually getting infected and inflamed years later. So that can be a major problem. And the other major problem with permanent fillers is if you develop a major complication, like if it's accidentally injected into a blood vessel. That's called an intravascular injection. And whenever you inject a filler into a blood vessel, an artery specifically, you can clog that artery, and any body part that's getting blood supply from that artery can literally turn black and die. So there have been people who've had injections of permanent filler, and they have actually lost parts of their nose, lost parts of their lip, and have even gone blind from it. Okay, so fillers are not something to monkey around with. If you're going to have an injectable filler, make sure it's not a permanent filler, because that can cause you permanent problems. Well, what's my number 3 cosmetic surgery to avoid? Lunchtime facelifts or threadlifts. Now these have the threadlifts were real popular literally 10 to 15 years ago, and they have reared their ugly head again. 10 to 15 years ago, doctors were trying to do these lifts where they're using single threads to thread and try to lift parts of the face. They didn't work. And these threads were permanent back then, so people would literally get a mild lifting for a month or 2, maybe 6 months, but be left with these permanent threads sticking out of their face. So they stopped being used. Well, now they're being used again, but now the threads are temporary. They are absorbable. And so you don't have the issues necessarily with them getting prickly and coming out of your face years later, but they still don't work. And that's why I don't recommend threadlifts. Lunchtime facelifts are something that were popularized several years ago with the lifestyle lift. And there are still doctors all around the country who are advertising their little mini facelifts, 1-hour facelifts, all that, it's all bullshit. None of it works, okay? And there are reasons why board certified real plastic surgeons like myself, my colleagues, don't do these facelift surgeries is because they just don't work. So if it sounds too good to be true, it probably is. If it's a family doctor, a dermatologist, a doctor who's not a real plastic surgeon telling you, oh, we should do this mini lunchtime facelift, it's all a crock. Don't do it. Save yourself from getting botched. All right, this is gonna upset some of my colleagues who do a lot of these operations, okay? But BBL, the Brazilian butt lift, super popular online. A lot of young people are getting their booties enlarged by taking fat from one part of the body and injecting it into the butt. This surgery works. We used to think it was very safe and a good alternative to buttock implants, which could also be a nightmare. But what we're finding is that this operation, injecting fat into the butt, has the highest death rate in all of plastic surgery. 1 in 3,000, according to one study, 1 in 3,000 people die when they undergo this operation. I mean, it is scary, and they usually die from what's called a fat embolism, where fat that's injected into the buttocks goes into the bloodstream and literally clogs the blood vessels surrounding your lungs, and it causes people to literally die within seconds. It is very scary. It typically occurs when the fat is injected into the deep muscles of the buttock, and even below that. If it's injected above the buttock muscles, it's typically considered a safe operation. And there are some doctors performing this operation throughout the country, like my good friend Dr. Matthew Schulman in New York City, who does it very safely. But there are a lot of doctors who do not. And so really be careful. This is a dangerous operation, the most dangerous in all of plastic surgery. You don't want some dabbler type of doctor performing this operation on you, because you could die and never wake up from the operation. So buyer beware with the BBL. Now, my final number one worst cosmetic surgery possibly ever is the donut breast lift. Okay, so if you know about breast lift surgeries, you know that they create scars. The scars that we do typically extend circularly around the areola, vertically down, and underneath the breast. Scars are permanent, they never disappear. They're long scars, so a lot of people don't want them. I don't blame you, if I could perform breast lifts without those types of scars, that's what I would do. So there was this procedure called a donut breast lift, where instead of having the scar all the way around the areola, down and underneath the breast, now we can just do it with a scar around the areola. Good idea, right? So doctors started doing that, and they're doing it still today. Well, the problem is that it's kind of like a rob Peter, pay Paul type of a scenario. You may undergo a breast lift with a scar around your areola, so that scar is just around the areola, but because the tension of the whole lift is around the areola and not on a vertical or underneath scar, the scar starts to widen. And I have seen patients who've had donut breast lifts, and they come to see me to try to get them fixed because they have areolas literally the size of pie plates, like literally this big. So what happens then is the areola widens and it stretches, and you get this starburst type of a scar around it, and it looks terrible. And it's very, very hard to fix it in some patients. So I don't know of a single patient that I've ever seen that had a true donut breast lift with a amazing result. There's always something that happens. The areola changes shape, it enlarges, the scar gets wide. It can be an absolute nightmare. So I strongly discourage you from having the donut breast lift. So I hope this was helpful for you. 5 cosmetic procedures to avoid. Thanks for watching. Watch this next video for a lot more great information to help you prevent you from getting botched.